Hello guys, greetings of the day. I am your dentist and friend Dr. Gaurav Gupta from Chikitsa Dental. If we talk about replacement of missing teeth, the dental implant is costly as compared to other options. But no doubt, it's the best option. In fact, dental implant is the exact replica of missing tooth if we talk about the looks and function. But cost itself is not the only factor for not accepting the dental implants as a preferred choice for replacing a missing tooth. People have so many other myths and doubts about dental implant treatment. So guys, in this video, I'll be discussing about some frequently asked questions about dental implants. To start with, is the implant treatment painful? Yes, you can expect to feel some pain when receiving a dental implant. However, people who undergo the procedure often say that having a tooth removed is more painful. A dental implant requires that your dentist make an incision in your gums, but before that, the area is made numb with the local anesthetic, so you don't feel pain at all. How long does the pain last after the dental implant treatment? Keep in mind that you will experience some degree of pain or discomfort after the surgery, but that you can manage with some painkiller and over-the-counter medications. But at times you may not need to use them. Does getting a dental implant hurts? Most dental implant patients says the procedure doesn't hurt and the discomfort is minimal. Plus, implants are popular because they give patient a natural, long-lasting smile, allowing them to live and eat without holding back. So they can be a little bit of discomfort. What are the negative effects and risks of dental implants? It may include infection at the implant site, injury or damage to the surrounding structure such as teeth or blood vessels, some nerve damage which can cause pain, numbness or tingling sensation in your natural teeth, gums, lips or chins. How long does the dental implant procedure takes? The procedure of getting dental implants takes several months to complete from starting to end. It involves 3 phases: placing the implant. First, you undergo surgery to have the implant placed in your jaw, where it is covered over with the gum tissues and allowed to integrate with the jawbone for 3 to 6 months. After that, it's exposed out of the gums and then tooth is fixed over it. Can dental implants be done in one day? Yes, these are called same-day implants or teeth in a day. These immediate load dental implants allow placement of a temporary tooth during the same appointment in which we put the dental implant. But it varies from patient to patient. Not all patients are ideal for same-day implants. Are dental implants as strong as real teeth? As long as natural teeth can be fixed, they should be. A healthy and strong natural tooth is much more better than dental implants. Sometimes dental implants are better choice, especially if significant decay is involved and problem is beyond any conservative treatment. Can I get dental implant years after extraction? Yes, if you had teeth extracted 2, 5, 10 or any number of years ago and have not replaced them since, you may still be a good candidate for dental implants. Dental implants require healthy bone in order to be placed. However, even if the bone tissue has shrunk, a bone graft may be an option to restore it. What happens if you don't get an implant after tooth extraction? Failing to replace a tooth that's missing could even cause the adjacent teeth to become damaged or move out of alignment. The more time that passes, the more you increase your risk of teeth shifting, so much that there may not be enough space for the implant to be fixed. Can you get dental implants if you have bone loss? Bone loss is a very common side effect of tooth loss. However, techniques have advanced greatly in past 30 years, and now it's possible for most patients who have experienced bone loss to have dental implants. You might just require some other procedures simultaneously. If you have to get your teeth replaced, discuss the treatment plan in detail with your dentist. If it's possible to get the dental implants treatment done go for it. Don't hesitate because of some myths or irrelevant doubts. Goodbye, guys. Thanks a lot for listening to me. Eat healthy, stay healthy, and take very good care of yourself.